Hello everyone, and welcome to this live session, and a very happy Diwali to all of you in advance. I'm Dr. Gorika Bansal. I'm a pediatrician and a newborn specialist practicing at my own clinic by the name of Babies and Children's Medical Center at Green Park, New Delhi. So today I have come live to kind of share with you all a few tips to kind of deal with this hazardous air pollution that we're going through, especially during this COVID pandemic. So to begin with, I'd say that it's important that all of you, before venturing out of your houses, take a note of the level of pollution that is there in your surroundings and then decide accordingly. So once we end this chat today, you could probably download this app called the Suffer Air app. So which kind of tells you about the air quality index in your surroundings at that point in time. So before starting this live session, I was just going through the app myself, and the air quality index today is in the hazardous range. It's about 538, which is way beyond the normal levels. So a brief bit about this AQI. What is this air quality index that I'm talking about? So just like our traffic red lights, the signals that we have, the green light says go, the orange light says slow down, and the red light says stop completely. Same way, the AQI basically has color coding. So this is a parameter. This is like a scale from 0 to 500 that tells us that if the pollutants are in the range of about 0 to 50, which is the green zone, the air is absolutely great and absolutely fresh to breathe. But if it's in the yellow or the orange zone, then preferably you need to be the people who are more susceptible, for example, the children, the elderly, the pregnant women, the people who have asthma or cardiac illnesses should definitely stay indoors during those times. And if the air quality index, the color code is in the red zone, then as I said, the traffic signal, red means completely stop. So you need to definitely be indoors. The healthy population is also at risk. So now, having said that, I'm sure all of you are aware of all this. You've been hearing a lot of PM 2.5, PM 10, the gases, and all of that ozone thing, etc. But even after being informed, in my own family, I'd say my own parents, they, in spite of the levels being so high, they go for their morning walks. So, I'd say that although we cannot feel the pollution, we cannot see it, but it is definitely very, very toxic, the kind of air that we are breathing. So anybody who's smoking for long periods of time, for years together, their lungs become black, they become tarred, and they become very stiff. The elasticity is lost. So something similar is happening to our healthier lungs right now, breathing this kind of an air. So as I said, the AQI is a parameter that kind of tells us the color coding. And if it is in the red or the maroon zone, beyond orange, you should be careful enough to step out. So I'd say delay your morning walks. Do not go in for your evening walks. If at all you have to go for your fitness, you can go in the afternoon, probably around 2 to 5 p.m. That will, when on a sunny day, that will be a better bet. Now, as I said, that the AQI is calculated on the basis of about 8 pollutants, which kind of includes the PM 2.5, the particulate matter 10, sulfur dioxide, nitrogen dioxide, carbon monoxide, ozone, and heavy metals like lead. So what is this PM 2.5, PM 10? So basically, these are very tiny particles, very, very tiny, as thin as even much thinner than the diameter of your hair. So these particles try and enter into the airways and your lungs. So PM10 particles get stuck in your nasal airways. But the PM 2.5 kind of fool the nose, fool the airways, and directly go into the lungs and cause damage there. So as I said, the tip number 2, so first tip is restrict your outdoor activities, especially during the morning and the late evening hours. Tip number 2 is that you do a lot of nasal irrigation. So as I said, the PM10 particles get stuck in your nasal airways. So the openings, the mouth and the nose is the inlet for all these things to get in. So might as well just drain the entire thing out. So, nasal irrigation with normal saline, or even povidone iodine. So betadine, you can really dilute it well and then do a nasal irrigation, nasal wash with that. That's also protective against the COVID-19. Another thing, as I said, the gargling, the warm saline gargles, the betadine gargles, or even the tea bag gargles are going to be helpful, again, to wash off the pollutants from your throat. So that's another thing. And number 3, I'd say, very important is the indoor pollution as well. Now, as I said, you do not go outdoors. You're supposed to be indoors, especially morning and evening. Now we need to understand the indoor air quality as well, which we think that, our indoor air quality is wonderful, but I'm sorry to say it's even worse than the outdoor air. Why? Because the outdoor air leaks out from the windows, the cooking smells, the cleaning, the dusting, all of this aerosolizes the allergens, the pet dander, etc., the molds, etc., are aerosolized. And that is what we are breathing 24/7, more so because of this COVID pandemic. We are more indoors, so more the chances. So what do we do for that? So my tip number 3 would be that first and foremost, whenever the cooking is happening in the kitchen, we need to install a chimney and we need to keep that on, this exhaust fans on. Even while bathing, keep the exhaust fans on. Install an air purifier if you can. That'll be wonderful. Please, so many people ask me, what kind of an air purifier should we buy? There are loads and loads in the market. So I'd say that buy an air purifier that suits your room size. So for example, a drawing room, you buy a bigger one. For a room, you buy a smaller one. Ensure that you place the air purifier in the center of the room and not the corner, so that it sucks the air, purifies it, and sends it across. So it's like a dialysis, it takes in the bad air. The dialysis, we kind of purify the blood and send it back into the body. Same way, the air purifier sucks in all the polluted air, passes through a lot of filters, and then spreads out the fresh air into the surroundings. So that's why you keep it in the center of the room. Secondly, ensure that your air purifier has a HEPA filter. So the HEPA filter is the one which kind of entraps all these particulate matters, the allergens, the molds, the dust mites, and the dust. So that is what is majorly needed. Of course, the other filters like the pre-filter, the carbon filter may be there. Carbon filter is majorly used to entrap the gases, the sulfur dioxide, nitrogen dioxide, carbon monoxide, and all of this. So a HEPA filter, which has a good MERV rating. Now I know all these words are completely alien to you, and so are they to me. But if you just remember, the MERV rating is the minimum efficiency reporting value of the HEPA filter. So it should be somewhere between 8 to 13, preferably 11. That tells us that the efficiency of the HEPA filter is wonderful. I'd say another thing in the air purifier that you need to see is the CADR rating, which is the clean air delivery rate. So an air purifier which has a higher clean air delivery rate is a better air purifier. So whenever you're buying an air purifier, just keep these 2 things in mind: the HEPA filter with a good MERV rating and the CADR rating. And also, as I said, the filters need to be changed every 3 monthly. So, buying an air purifier is one, but also maintenance is another thing, because if the filter is completely clogged, it's not going to function properly. And it can be more detrimental to your health than be beneficial. So that's about the air purifier. Now, coming to the air purifying indoor plants. So I'm sure all of you are aware of this, but just to summarize a little, probably we can have aloe vera plants, the bamboo shoot, the snake ivy plants, toxic gases, and dispel the fresh air, the oxygen into the air. All right. And also ensure that you also ventilate the indoor air, preferably around between 2 p.m. to 5 p.m. Do not open up your windows in the morning hours or the evening hours to soak in that fresh air. It's no more of fresh air. It's a very toxic air. So preferably in the afternoon hours. So now we've spoken about the outdoor air. We've spoken about the indoor air. Now let's talk about our own internal body system. So the onus is on us to detoxify our body, to help our body fight this COVID-19, help our body fight the pollutants. So the best bet is to have a very well-nourished, balanced diet full of antioxidants and having lots of vitamin A, vitamin C, and vitamin E. So to brief a little bit, I'll just say that have a lot of fruits, preferably guavas, papayas, kiwis, oranges, and a lot of veggies, maybe broccoli, maybe bell pepper, green leafy vegetables, have a lot of nuts to as a source of vitamin E. So walnuts, sunflower seeds, chia seeds, having almonds, soaked almonds would be good. So, and using turmeric, using ginger, herbal tea, using maybe cinnamon tea, green tea, something like Kashmiri kava that they make with almonds, lemon, and cinnamon. That's also a wonderful antioxidant drink. So keep yourself well hydrated to remove all the toxins from your body. Have a good balanced diet and take care of your mental health as well. Do meditation, do breathing exercises, especially kapal bharti. So you remove all the toxic air from your lungs. You also can do Bhastrika pranayam and all of that. So that's going to be very helpful to calm your mind and keep your lungs healthy as well. And of course, a little bit of think about the masks. I'm sure you're all aware of all the masks that are there. But what are the anti-pollution masks? So the anti-pollution masks are not the fabric masks or not the surgical masks. They are mainly the N95 and the N99 masks, because these are the masks that actually filter out these very tiny 2.5 particulate matter, 2.5 micron size, and even lesser, up till almost 0.3 microns. So these are the masks that you need to use as anti-pollution. But the most important criteria is that they should be snugly fit. So it should be completely fit onto your nose, the mouth, and below the chin. So if at all there is a slightest of that leak, it's as good as not wearing a mask, because the air has to go through the mask, through the filters, and then go into your lungs. And if at all it's not snugly fit, the air is going to enter through the gaps and you'll be breathing the toxic air again. So in spite of wearing the mask, it will not be helpful. So ensure that the mask is snugly fit. You change the mask frequently so that the filter quality is good, and preferably use an N95 if at all you have to step out in the morning or the late evening hours, because the N99 mask is wonderful. It kind of almost removes 99% of the particulate matter and makes it very, very fresh, but the resistance to breathing is it's very high. So it's very tough to breathe from an N99 mask. So N95 would be a good option. So I'd say that's all about from me about this, and I wish we had more time. I would just talk about the coughs that are, how do you differentiate between the flu cough, the COVID-19, and the allergic coughs that are going around. Probably next time we'll talk about it, and let's just take up your questions, and let me just see if I can answer them to the best of my capability. So going ahead, yeah. So it says, Lakshmi. Lakshmi says, help me with, hi Lakshmi. She says, help me with some guidelines on how can I take care of my child when I travel. All right. So Lakshmi, I'd say that it is best to avoid travel right now, considering the situation. But if it is absolutely mandatory for you to travel, preferably your own transport, using your own car, using your own vehicle is going to be the better bet. But if it's a public transport, so preferably, take a sanitizer, regular hand washing, taking care of the fluid intake, and also masking up yourself, preferably an N95 mask, and not touching the high touch surfaces, sanitizing them before you sit, and preferably opting for a window seat wherein you are at a distance from other people, and carrying your own food and water would be the best advice that I can give you, because as I said, the immune system needs to be boosted well. So keep yourself very, very well hydrated. Having lemon water or maybe a warm liquid, warm soup would be a wonderful option. And of course, avoid touching your nose and your mouth and your eyes during travel, and keep a regular hand washing and follow the cough etiquette and physical distancing. All right. The next question is, can I take, so Lakshmi again asks, can I take my child to malls or any other place? Will that affect my child? Lakshmi, as I said, that, only venture out if at all, it's inevitable and it's really, really mandatory. Try avoiding all these crowded places any which ways, because the festival season around, people are going out shopping. So it will not be a good idea to take your child to a mall. Instead, take him to a park during the afternoon hours, as I said, when it's the least crowded, and that will actually relax their nerves even better. All right. The next question is, okay. Hi, Navlax. She says, my 6-month-old needs to go for a checkup every 1 month. What kind of a mask I need to use for my child? Okay, so as tiny as 6 months. So the WHO says that, the WHO guidelines say that we do not need to mask up our children below 5 years of age unless and until it is really mandatory. So going to a clinic, of course, you need to, as I said, if at all you have to, keep your ensure that you are waiting in the car until your name is called out at the clinic reception, and whenever you're entering, keep your visit very, very quick. And I would not suggest that you need to really mask your child in that case. In case you have to, then maybe a fabric cloth mask would be a good option, but ensure that the visit is very, very brief, so that, because in a child who's 6-month-old, he cannot really tell you that I'm feeling suffocated. So that's why the WHO recommendation, the guideline is that children earlier, the American Academy of Pediatrics says that children below 2 years should not be made to wear a mask, and WHO says not below 5 years. So as I said, preferably they should not be given a mask to wear, but in a place like a clinic, ensure that your visit is very brief and you go in whenever that your name is called out. So, all right. Another question would be Prachi. Hi, Prachi. You're asking, is an air purifier necessary inside the house during peak pollution time? Yes, Prachi, as I said, the air is no longer fresh air that you're breathing. It's a very toxic air. And so at least whatever time we're spending indoors, let it be the most freshest air that is possible. So air purifier would be a very wise option and a wise thing to invest in at this point in time. Okay. The next question is, Prachi again asks, can my 2-year-old wear an N95 mask or a cloth mask to save from air pollution particles outside the house? Okay, so Prachi, as I said, the cloth mask, the fabric mask, or the surgical mask, it basically prevents only the large droplets from coming out. So, if a child coughs, or even you're talking, when you're yawning, breathing, the large droplets get filtered out so that it does not reach the person facing us. So it will not prevent the polluted air particles to come inside our body. So the only way out is the N95 mask. Preferably keep your child indoors if you can. If you have to step out, then an N95. Yes, you can make your child wear an N95 mask, but definitely under adult supervision and for very brief periods of time. Maybe say about 15 minutes or 20 minutes, not more than that, and ensure that the mask that you use should not be worn for a very long time. So, you can maybe use for so every mask that you use has a time frame. It tells you that these many hours is the time that you can use this mask. So so depending on the usage, you can understand how many days this mask would last you. And if the mask becomes moist, if it's difficult to breathe from that mask, or if it's ill-fitted, then you know that it's time to change your mask. Okay, let's take another question. Okay. Hi, Doctor. Varsha. Hi, Varsha. So she's saying, my son is 3 years old, and I noticed that whenever we go out and wear the mask, he's not comfortable with it. Is it okay to go with a mask, or what should I take care of? Okay. So Varsha, that's a very good question, and I'm glad you asked me that, because that's a very, very common thing. Many of my patients as well say that, Ma'am, my child refuses to wear a mask, and they go really paranoid. Of course, as a parent, you're scared of that COVID-19 going around. So I totally empathize with you, but I'd say that, take it easy. First and foremost, begin begin by giving your child the mask at home, number one. So, for very brief periods of time, maybe for a few seconds or a few minutes, you tell him that let's play a game. So you become the doctor and I'm the patient, and the doctor always wears a mask, or a nurse always wears a mask, and you're coming to examine me. And even, while playing, you kind of make him wear that mask, and you give him a positive reinforcement. You kind of reward him for wearing even that small bit of, for wearing the mask for even that small bit of time. and you say that, as you tell him that, you've done a great job. Another thing that you could do is, whatever dolls or the stuffed toys he has, you can make them wear the mask, and you can tell him that, see, it's so exciting, your doll is wearing a mask, and she is kind of trying to protect you from spitting out, from giving you all those large droplets, and she's helping you stay safe. So, number three, I'd say, explain to your child why we need to wear a mask. So many children need a lot of, they are wise enough to understand what is going around, and you can tell them that, there's this virus going around in the air, and it enters our nose and our mouth if we leave it uncovered, and if it enters into our body and makes us fall sick. So, and also, when you're wearing a mask, you're protecting the other person from catching it. So you're doing a good job, you're helping others by wearing it. So, this sort of a charitable work that you're doing is really going to be very, very good, and it's going to bless you and long, whatever. So you can make stories and tell your child that it's a very good thing that your child is doing for others and for himself. Number four, I'd say that, do not get anxious when they refuse to wear the mask. Try and understand, try to calm them down, and preferably, if they're at a distance, physical distance of about 6 feet or 2 meters, then they're pretty safe. So do not get worried. But of course, if you're going to a crowded place, the better bet would be to wear a fabric cloth mask, which is prepared at home. So you can do it yourself. You get these videos on YouTube, or the DIY videos, wherein you can prepare your cloth mask, and your child can paint it or color it, and then once he kind of does it on his own, he will feel more empowered to wear it. And you can also cook up a story and say, there is a virus that's going around, and we are the policemen, and we wear masks to catch that virus and to look out where this virus is hiding. So, but this virus can also attack us if you're not wearing a mask. So, all these stories, role modeling, be good role models, and tell them that, how healthy it is to wear a mask when you're outdoors. And of course, try avoiding the crowded places as much as you can, and slowly and gradually increase the time limit to, maybe a few minutes to half an hour, and hopefully your child will cooperate, I'm sure. But be very, very gentle with them. Okay. I think that's about it. Yeah. So Varsha is asking, how does air pollution affect babies? So hi Varsha. Varsha, I'd say, see what happens when these very tiny particles, as I said, when they evade the nasal passages, the airways. So there are a lot of brush borders in our airways. So the way our broom is in our homes. So they do the brooming action. They kind of entrap these particles, they secrete out the mucus, and then they take it out. So the coughing, the sneezing mechanism is a way to throw out these dirty particles. But when the particle is as tiny as a 2.5 micron particle, this kind of fools the system and kind of enters into the airways, and it irritates the lungs, irritates the airways, and causes a cough, a dry irritating cough. It can even lead to wheezing. It can lead to allergies. It can lead to shortness of breath. Your child can feel, when he's walking around, he can feel that he's unable to breathe. He might feel suffocated. There may be dizziness, or there may be a sensation of vomiting. So, and also a sense of fatigue in elders. So, all these signs tell us that our body is not getting enough oxygen, is not getting enough good air to breathe. And also, these particles tend to irritate the airways. The ozone can cause inflammation in the airways that can narrow these passages. The pipe that is there, the airway, can narrow down. So when the air goes through this narrow airway, the narrow passage, it can lead to a whistling sound called wheezing. And so all of this can lead to allergies in the long runs, and is definitely harmful for your airways and for even the normal metabolism, the metabolic growth, and also the growth of the child. So it's important, it's very imperative that we all understand the hazardous effects of this air pollution. I'd say more than the COVID-19 pandemic, the air pollution, the kind of toxic air that we are breathing is more disastrous and needs to be addressed at a very quick rate, so that our children have a better future and have a better air to breathe in. Take care, and I hope that answers, and I hope this session was helpful in the slightest way. I wish you all a very safe Diwali, and please stay safe and do not burst crackers, I'd say, and instead light diyas, candles, and stay indoors with your own family, and celebrate this festival in a happy way, in a pollution-free way. Take care.